Hello, are you someone who gets told a lot that your eyes look tired, you haven't slept well, you feel like they're looking quite baggy, and you've tried all sorts of treatments for this, but nothing really seems to help, and you're wondering if there is a simple, long lasting solution? I'm Dr. Aniketh Venkataram, plastic surgeon at the Venkat Center, Bangalore, and today we will talk about blepharoplasty. Now, what exactly is blepharoplasty? In common terms, a blepharoplasty is a surgery done to improve the appearance of the eyes. Specifically, it's a surgery done on the eyelids. It can be done on the upper eyelids or the lower eyelids, and can also involve the areas around the eyes to improve the face as a whole. Let us learn a little bit more about what exactly happens during this surgery. So, who is a good candidate for this surgery? Well, there are two types of patients. One is those who have eye bags since a very young age. It might be genetic, it might run in their family. So these patients usually are operated around their late 20s, early 30s. It can also be exacerbated by their job and their lifestyle. The second group of patients are those whose eyes looked good early on, but they started having changes as they got older. The eyes started appearing heavier as they got older. This group of patients usually gets the surgery done at around 40, 50, sometimes 60 years old. Now, what are these changes? What exactly are we trying to do in a blepharoplasty? To understand this, we need to understand what happens as a person grows older. So in this photo, on this side you can see a young face. On this side you can see an older face. So what are some of the changes? Let's start from above. So you can see the eyebrow goes down, it droops. You can see that the upper eyelid starts appearing very heavy. There's a lot of extra skin which starts falling down. You can see that the level of the eyes isn't the same. What used to be horizontal now starts falling down. And the lower eye, what used to be a smooth lower eyelid, now starts having various kinds of bags. These are some of the changes that happen as someone gets older, and these are some of the changes that we try to fix during a blepharoplasty surgery. To understand these changes more in detail, you need to understand what happens with the fat in the under eye area, particularly because the under eye is one area that a lot of patients have complaints. So there are two kinds of fat here. One is known as orbital fat, which is the fat around the eyeball. The second is the cheek fat, which is the fat in the cheek. Now, as someone gets older, the orbital fat, the fat near the eyeball, starts coming out, and that's what forms the bag. The fat in the cheek starts reducing, and that's what forms a groove below the bag. So this makes the bag look even worse. So there are two kinds of fat here, and both of these need to be addressed during the surgery. So what are the benefits of this surgery? Well, obviously, it makes a marked improvement in your appearance. The eyes look less heavy, they look less tired, you look brighter, you look younger, you look fresher. It can also, if someone's lower eyelid is drooping a lot, it can also improve eyelid function and tear functions. The eyes can water less and blurring can be less. But more than anything else, this leads to an improvement in self-confidence. Are there any alternatives to blepharoplasty? Is there any non-surgical option? There are, but you need to understand something about surgery versus non-surgery. The advantages of non-surgical options are that they don't take time out of your life. You can get them done and be back to your routine the next day itself. The disadvantage is that one, they cannot give as dramatic effects as a surgery, and two, the results don't last as long as a surgery. Now, what are the non-surgical options? For the lower eyelid, if there are eye bags, those eye bags can be partially hidden by using something called fillers. A filler is a jelly-like material that you put below the eye bag, and this kind of helps hide the eye bag. So you're not actually treating the eye bag, you're kind of hiding it. So this gives you a partial improvement, and it lasts for around 1 year. The other thing which can be done for early eye bags is a treatment called Accutite. We have a video on this, and you can follow the link mentioned to see that video. Accutite uses radio frequency energy to shrink the skin. Now this works well, but it works for mild eye bags. It does not work so well as the eye bags become heavier. So it's a good option for earlier grade issues. Higher grade issues, surgery would be the better choice. Now let us talk about the surgery itself. This is a daycare surgery. It is usually done under general anesthesia, or it can be done under local anesthesia with a little bit of sedation. The patient comes, gets it done, goes home the same day. There's no admission. Now, after the surgery, there will be a little bit of swelling. We will talk about that when we come to the recovery section. Now let us see what is done during the surgery itself. So starting with the upper eyelid, we will cover the surgery in 3 sections: upper eyelid, lower eyelid, and other things that can be done around. So in the upper eyelid, typically there is a lot of excess skin. So an incision is made to remove that excess skin. This incision is placed in such a way that it comes in a natural eyelid crease. Everyone has a crease in their upper eyelid. So the scar after surgery comes in the same crease. So it's very difficult for someone to know that a surgery was done. After the incision is made, the extra skin is removed and some extra fat in the upper eyelid is also removed to make the eyelid less heavy and to improve the groove. Then a stitch is used to close that. This stitch is there for around 1 week and it is removed after 1 week. In the lower eyelid, if there is a lot of bagginess, what we do is we go in through the conjunctiva, that is the pink part of the eye. So we go in from the inside and through that we remove the excess fat. Remember what I said about orbital fat coming out? That is the fat that we remove in this surgery. In early grades, just removing the fat is enough. We don't have to do anything on the outside. But in later grades, if there is extra skin, we remove a little bit of skin on the outside as well. And that mark comes in the groove below the lower eyelid. So that mark is also hardly visible. Along with this, another thing that we frequently do is tightening the lower eyelid. So if the lower eyelid is quite saggy, as you can see here, it starts drooping. The line is no longer straight. So we can use a stitch to tighten the eyelid, and this helps improve that. It also helps improve tear function. Another thing which can commonly be done is we can do an Asian blepharoplasty. This is done in patients who want a deeper eyelid fold in their upper eyelid. So for this, we create an attachment between the muscle and the skin to create that groove. We have another video on Asian blepharoplasty which you can also check out. Now, what are some of the other things that can be done at the same time? If the eyebrow is drooping, we can lift the eyebrow as well and done what is known as a brow lift. If there is a lack of cheek fat, we can add a little bit of fat grafting. This can seem a little confusing. We're taking fat away from one area and adding fat in another area. But that is because, as I said, there are 2 kinds of fat doing 2 different things. The orbital fat which is coming out has to be removed. The cheek fat which has reduced has to be replaced. So here you can see an example of the fat grafting that is done in the cheek. So this improves the appearance and also gives a little bit of volume in the cheeks and can give a little bit of a lift. All of this can be done together in the same surgery. Now, what is the recovery after the surgery like? Like I said, you come, get it done, go home the same day. There's no admission. The eyes are a part of the face that swells up very easily. So there will be some noticeable swelling. This swelling takes a little time to go away. You feel pretty normal within 2-3 days itself, but it will appear swollen. So if you're working from home, you can work from home within 2-3 days itself. Most of the noticeable swelling goes away in around 7 to 10 days. So after 7 to 10 days, it's hard for someone to make out that you've had a surgery done. But for the full result, for all the swelling to completely go away, that takes around 4 to 6 weeks. Apart from swelling, a lot of people get bruising. Bruising is reddish marks in the under eye area. It's like someone hits you, you get a reddish mark. That is called a bruise. Bruises around the eyes are common. If bruising happens, it can take around 2 weeks to go away. This can be covered with makeup. Now, it is very important that this surgery is done by someone who knows what they are doing. If you don't know what you're doing, there are important structures in this area which can be damaged. There are muscles which move the eyeball. Further down, you have a nerve here. So, it is important that all of this is respected. If these are damaged, those can be complications from this surgery, but that will not happen with someone who is experienced in the surgery and knows what they are doing. So that brings us to the topic of possible complications. I've already mentioned swelling, I've mentioned bruising. Other complications can only happen if someone does not know what they're doing. A lot of people seem to have the idea that this is a very simple surgery, you just remove a little bit of skin and that's it. That is not how it works. It is much more complicated than that. As I've explained to you, there's a whole lot of things that can be done during the surgery, and each patient has to be evaluated properly on what they need. There are many non-plastic surgeons doing the surgery where they just remove a bit of skin in the upper eyelid. Well, that is easy, but it's also not going to give you a great result. You're not taking care of all the issues. You're not taking care of the fat. You're not taking care of the lax eyelid. You might not be taking care of the eyebrow or the lack of volume. So, do not get this done cheaply by someone who isn't qualified. Get this done by a trained plastic surgeon who knows the anatomy of this area and knows what all changes have to be addressed to give you the best result. Now let us look at some real life results from patients. So here we see a patient. She had lot of bagginess in the lower eye and excess skin in the upper eyelid, and you can see there's a groove below the eye bag. So in her, we did upper plus lower blepharoplasty. You can see the upper eyelid looks nicer and crisper. Lower eyelid is now smooth. You do not have those eye bags anymore. In her, we had also tightened the eyelid because it was kind of falling down. You can see the looseness over here. We've also done some fat grafting into the cheeks to improve her overall facial appearance. And you can really see from this oblique view how much bagginess there was and how smooth it is appearing. And here again from the side, you can see this is the orbital fat that was extra that we have removed. This is the cheek fat that wasn't enough, which we have added, and that's what gave us this result. Here's another patient who had severe eye bags, and we have taken care of the eye bags. Just to go back to the previous patient, in this patient, you cannot see the scar. We have done upper and lower blepharoplasty. So there is a suture line in the upper eyelid. There is also a scar in the lower eyelid. But it's impossible to see in the after photo because those scars are hidden within the natural human grooves and creases. So that's why when well done, this is a very difficult surgery to make out. In this patient, we have only removed the fat from the inside. We have not removed any skin. So there is no scar on the outside for her. In this patient, you can see there was a lot of laxity. His eyelids were falling down. And after surgery, you see this angle, it is now looking straight. The eyelid has been tightened. The lower eye was very wrinkly. It is a lot smoother. This is an example of an Asian blepharoplasty. This patient had a very low eyelid crease. She wanted a higher and a sharper, deeper crease. So this is the higher crease that is a lot deeper. This is around 2 weeks after surgery. So you can see that it does not look surgical, but it's still a little swollen. And that is what takes a little time to fully go away. Lastly, I want to conclude by saying, do your research about this procedure. Do not underestimate it. It is a lot more complicated than just removing a piece of skin. That is not going to give you a very good result. So this is a very complicated area. It's a very safe surgery. This surgery, when done right, can give very good results. It does not affect your eyeball or your vision or anything like that if that's what you're worried about. But it has to be done by someone who knows what they're doing. Do your research and get it done by a trained plastic surgeon. I hope this video was informative for you. Do like, share and subscribe. Let us know in the comments about any of the videos that you'd like to see. Thank you. Have a great day.